Welcome to the NWA-ETC Project Echo. I'm Kent Unruh, and I'd like to turn it over to Dr. Brian Wood, our medical director, to introduce our guest.
Well, it's a pleasure to have Ben Atkinson back with us to do another talk. Ben is one of our nutrition experts here at Harborview, and without further ado, I will turn it over to Ben.
Glad to be here. Thank you, Kent and Brian. Happy to share some information on multivitamins with you guys. And originally when I was preparing for this talk, I was going to tackle a bunch of different specific vitamins. But I actually had several patients come up to me recently, talking about multivitamins. So I think we should really focus on that, and we'll keep it simple today. Maybe at a future lecture, we can look at specific vitamins or minerals. Here's what we're going to learn today: what a multivitamin is, what it contains, how many people are using these, and who does and doesn't need them. Then I'll give you some practical tips on how to kind of assess who does and doesn't need them. I think some stuff that will be useful for you in the clinic that you're working in. So this is basically, and I don't say basically like just as a filler word, but like what a basic multivitamin generally contains, especially when you're looking at some of the research studies that I'll cite here in the future slides. But it is pretty basic. A couple fat solubles, a couple water solubles, mostly your B vitamins, and a handful of trace elements. But the important thing I do want to note is that in the real world here in the United States where we're working, a multivitamin that you buy off the grocery store shelves is going to contain at least twice the amount of these micronutrients, as well as probably a handful of other herbs, other substances, amino acids, I mean, you name it. So we do need to be careful and read those labels. This patient that kind of got me thinking about this multivitamin issue. He's a guy I see at least once a month. He's on heart, in general, relatively healthy guy, middle age, healthy body weight, but I would say his probably biggest problem diagnosis is that he pays too much attention to popular media, popular magazines. I mean, not just Dr. Oz, but Men's Health magazine. I mean, he's always bringing me clippings out of there. He came with me asking me what he should take in terms of dietary supplements. And these are some of the things that Dr. Oz, Men's Health magazine, all these places had told him that he needed to take. So pretty extensive list. And I think the other thing we need to keep in mind is that probably these 5 items each cost maybe $10 for a month's supply at the cheapest if you're getting generic versions. And for people who are on limited incomes, I really cringe at people buying this stuff instead of a bag of oranges, for instance. I mean, I feel like they could make their dollar go a little further. But this is what this patient wants to take. And so my question is, does he need it? Part of my job is assessing his food intake, and when I do that, and I'll show you how to do that here in a few slides, he's eating relatively healthfully. His dietary intake is slightly low in vitamin E and folic acid, and since I know this patient pretty well, he's on a pretty low fat, pretty low carb diet, and the reason why that's important is because vitamin E is generally found in foods that contain fat, so your vegetable oils, nuts, things like that, meats, very good source of vitamin E. In grains, most grains are fortified with folic acid. So this is not terribly surprising, but in general, he's getting 100% of the things he needs. So my question is Mr. H, my case study, is he like other people in the general U.S. population? And I would say the answer is a pretty resounding yes. About 40% of people are taking a multivitamin. And this number is even higher in women, probably because of the pregnancy issue. And when you poll people, most people report that it's to improve their overall health. So this very vague idea of improving their health. It's not for their bones or their cholesterol or some diagnosed issue. And I would say if research from the WISE cohort, which remember is a HIV positive cohort, nationwide group, if that's any example, only about 1/3 of our patients are actually reporting usage of these products to us. And I know just from my practice as a dietitian here at Madison Clinic, I can tell you that both myself and the doctors catch this stuff all the time, even after we've been seeing patients for years. That really the main people who actually need these multivitamins it's a very small list. I would say pregnant women is probably the obvious one because of their increased nutrient needs. I mean, they're making 50% more blood than they have normally. But I think when we're talking about HIV specifically, there's a lot of competing issues regarding your micronutrient status. IV drug use, opportunistic infections, and malabsorption all generally require increased micronutrients because they're either eating less or just absorbing less of the nutrient. TB specifically is something that uses vitamin B12 to do a number of things, including replication. So the host might need quite a bit more B12 there. But in general, a relatively healthy HIV-infected person, about 30% of our population are low in vitamin B12, and about 40% are low in zinc. And I think, especially when we're here in Seattle, I don't know if it's like this in other parts of the country, but we have a lot of vegetarian or pseudo-vegetarian eaters. And that there are very few sources of B12 that are non-meat based. And zinc, when you are eating a lot of plant-based foods, is really bound up by the phytic acid. So you generally need about 50% more zinc if you're eating a mostly plant-based diet. Something I find interesting. So again, this list of who actually needs these multivitamins, if you're looking at like specific diagnoses, pretty small. It's not everybody, that's for sure. And it's darn near not 40%, like we see in the regular population. And again, most of our patients don't need this, and there is no large body of evidence that says we need to supplement with a multivitamin beyond what the recommended levels are. So those numbers that you see on the back of a nutrition facts label. But my question now is, are these safe? Some of these things are water soluble, for instance, and you can pee the rest out that you don't use up. But are they safe? And I think probably the biggest example of safety issues with multivitamins comes from the senior author is Fawzi, and a lot of their studies take place in Tanzania. There's very few US-based studies on multivitamins. But this is a 2012 JAMA article that's cited below. And what they did was they took roughly 3,000 people in 2 arms and gave one a low dose of multivitamins and one a pretty high dose of multivitamins, so like 5 to 20 times what is recommended. And again, this study was powered to look at HIV health outcomes as well as death. And the point I want to make, the reason I put this picture up here is this really high dose of micronutrients is actually quite common to find on our shelves. And that's exactly what this picture is. I mean, this is what our patients are taking. They're not taking like a generic low dose multivitamin. They're taking like the really high potency stuff. And what they found was that there was no change in HIV-related health issues or death, and actually a slight increase in some of the liver function tests that we commonly test for with the high dose. So actually the study was stopped early because of that. So really no benefit and possibly some harm done with these arguably high doses, but remember, these are quite common doses here in the United States. Another nice study, granted a cross-sectional study, was this Nutrition for Healthy Living, NFHL cohort, another nationwide US-based cohort. They looked at both vitamin E intake and vitamin E serum levels and looked at subclinical heart disease outcomes. So your coronary artery calcium, your IMT, basically measuring the thickness of your blood vessels. And they found at the highest intake, there were some definite increases in heart disease risk based on these subclinical measures. And remember, vitamin E is going to be something that's in high doses in most of our multivitamins. And then some other information that I was hip to just a few weeks ago, actually, from our pharmacist, was that with one of our newer HIV medications, dolutegravir, there is a warning right on the box to not take this with most cations found in supplements, so iron and calcium specifically. But you could also lump magnesium in there, and it's really going to reduce the effectiveness of dolutegravir. We talked about who doesn't need them, and I said that there's no current evidence to supplement beyond the recommended levels, but the question is, how do we figure out if somebody's having dietary intake at the recommended levels. And what we do in the clinic, what I do in the clinic, is use a very standardized procedure to figure out how much food people are eating and then what nutrients that food contains. And this is based off a protocol from NHANES, the National Health and Nutrition Examination Survey. This is that big survey where we get information on, how obese America is, what kind of foods we eat, those sorts of things. A representative sample, and what they do is they do it in steps, and they're asking people what they ate yesterday, and they do this several times. So they'll do this over like 3 days, so they get a pretty good idea of like what a person is eating right now. The first time you ask them, you just want to ask, what did you eat yesterday? Just start naming off foods you ate yesterday. When they get done with that, I'll ask them a little more detail. How much did you eat? What time of day did you eat these things? And then the third pass, we're really getting at like the fine detail. Did you put sugar in your coffee? Did you even tell me about coffee? Are you a Mexican-American person and you're going to assume that I know you eat 6 tortillas a meal? So just getting more fine detail. And then we've got a pretty good picture of what this person is eating right now. The next step is to analyze this information. And this is some information that this is my breakfast that I ate today. And I used MyFitnessPal, which is a nice free either cell phone app or you can use this on your desktop computer as well. Very user-friendly. And so this is something, in your clinics that could be a nice tool to use. And I would actually recommend, saving some time, because we're all busy, having your patient do this at home, showing them how to log the foods, get a login, that kind of thing. And then bringing this information to you at the next visit where you guys can discuss. The other nice option is that you can, very similar to Facebook or other social sites, you can friend your patient. And there are some privacy settings you can use on here so that, like, if you have multiple patients friended, you can keep those separate. HIPAA protected health information. This is a big deal, right? But you can look into their food and exercise also logs and see what they're eating, give them some feedback in real time, and it's a very nice tool. So that's one way we can assess intake, and then we need to figure out what we're going to do. Are we going to supplement them with a pill, or my favorite, we can supplement them with food? Remember at the beginning I was talking about how expensive these supplements are, and I don't know about your pharmacy in your clinic, but even for cheap, generic multivitamins or even specific vitamins, a lot of times insurance will not cover those, and your pharmacy will often have to pay some sort of dispensing fee. Maybe it's $5 or $6, but that can add up for a patient on a limited income, and $5 or $6, like I said before, can get you a bag of oranges, or if you're low in vitamin C, there you go. You got your oranges, you're good to go. And so what I'll do if somebody's low in a specific nutrient, we can look at the food groups. If you're low in vitamin C or folic acid, let's get some fruit in your body. Low in vitamin A or some of the other B vitamins, let's get some more vegetables in your diet. Low in some of these minerals, let's look at your meat or bean or nut intake. Selenium, we can look at the grains. And obviously, if you're low in calcium or vitamin D, we can get you some more dairy foods. We have some tools on how to assess intake. And if your patients are low in intake, based on calculations done off that MyFitnessPal or other programs, let's try supplementing them with food first. And then if they do not make much progress there, or if lab values indicate, we can look at some pills. But I think now you guys have some nice user-friendly tools at your disposal to assess intake and decide who actually needs supplementation.